We have you for 10 minutes and I will pass that time to you now. Thank you.
Thank you. Kia ora, tēnā koutou katoa. Ko Lizzie Barratt tōku ingoa. I'm a health promotion advisor making the submission on behalf of Alcohol Health Watch, a national organisation funded by Te Whatu Ora. Our work functions through a health promotion approach and is therefore committed to reducing and preventing alcohol-related harm. The cyclical relationship between mental health, addictions and trauma has been a part of my life for as long as I can remember. I'm an adult child of an alcoholic. My mum got sober when I was 4, and her sobriety is the only reason why I have the opportunity to be here in front of you today. Our experiences drive my commitment to the broader push for a more compassionate and humane mental health and addiction system. I'd like to acknowledge tangata whai ora and the people who have experienced the mental health system's ongoing legacy of harm. We're here to tautoko their input on this bill and that of mental health advocates, being that it's not transformative enough, is inconsistent with expert advice, has missed a crucial opportunity to eliminate seclusion and restrictive practices, and therefore breaches international human rights laws. Our submission is based on the premise that everyone deserves the right to safe, responsive, and appropriate healthcare, because we've heard both sides of the contradictory story. People desperately wanting compulsory treatment because their addiction is, by definition, an uncontrollable health condition, only to be met with exclusionary entry criteria or the perception that there's no point in treating them. The discrimination and dismissal of people's symptoms, leaving coexisting and interrelated problems unaddressed. And despite the overrepresentation of people living with fetal alcohol spectrum disorder and other neurodisabilities in the mental health and addiction, justice, and state care systems, FASD awareness remains lacking and treatment remains unresponsive. While compulsory treatment can be a protective factor enabling people to get sober, it also broadly traumatises people, compounds inequities, and may trigger substance use disorders. Putting people who have experienced violence and trauma into violent and traumatising institutions only serves to reinforce cycles of harm. Nowhere is this more apparent than within forensic mental health units. There is very little room for rights-based care within a system designed to criminalise and punish the people within it. We therefore believe this bill is inadequate to preventing and addressing the harms resulting from all forms of compulsory treatment. Our main point on this bill is that until earlier and safer intervention can actually be provided, merging the Mental Health Bill with the Substance Misuse Act could create an opportunity for legislation that reflects the needs and realities of the people it's supposed to serve. The separation of compulsory treatment into 2 laws drives the chronic divide between mental health and addiction services, based on boundaries that often don't exist in people's realities. This separation underlies the pattern of people with coexisting problems falling through the gaps until they reach crisis point, having been met with widespread systemic failures and stigma when they try to seek help. The direct impacts of these failures, including but not limited to poorer treatment and therefore worse treatment outcomes, lower life expectancy, and higher rates of all-cause premature death, including death by suicide, are an undeniable health equity issue warranting your consideration in this legislation. The second point we'd like to make about this bill is that it's been pushed forward in the absence of an all-of-government mental health strategy. The Abuse and Care and Te Ara Oranga government inquiries very clearly demonstrated that the consequences of social inequality fundamentally drive the unfair burden of mental health and addiction challenges in Aotearoa. But action on these drivers remains lacking, and the need to address them has never been higher, with the government's approach towards crime and violence and families increasingly finding it harder to make ends meet. However, as the most widespread and harmful drug in Aotearoa, alcohol also remains a significant and preventable driver of our mental health crisis, both predisposing and worsening mental health conditions alongside compounding the inequities which influence their existence. Strengthening our alcohol regulations is long overdue, being one of 2 He Ara Oranga recommendations the government decided not to implement, despite the drivers of alcohol-related harm being more widespread than ever. Our recommendations reinforce the long-established and primarily government-commissioned evidence base regarding best practice measures to reduce alcohol-related harm, including negative mental health impacts. We're calling on you to implement these measures given their relevance to the Mental Health Bill. Sobriety achieved within institutions is often unsustainable, as people return to the environments their addictions began within and then are punished for relapsing. New Zealanders deserve a more comprehensive, preventative and equity-based response to mental health and addiction, not one or the other, which truly upholds their rights to determine their own care and wellbeing journey. Thank you for your time. We're happy to take questions.
Okay, thank you very much for your